The April 26, 2011 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Ms. Andrews? Here. Mr. Daniele? Here. Ms. Cayley? Here. Mr. Lightfoot? Present. Dr. Quattro? Here. Mr. Rocco? Here. And Chairwoman Draw?
Here. Is there anyone signed up to speak this evening?
There is not.
Thank you. The next item on the agenda will be the approval of the minutes. You have before you the March 29th minutes. They will stand approved unless the clerk is notified of any changes by the end of the day. Next item on the agenda is new business. Madam Clerk.
All right. Referral 11-112.
Moved by Legislator Rocco, second by Legislator Quattro. Is there any discussion? Legislator Cayley.
Thank you.
I won't repeat that. Thank you. Thank you, Madam Chair. Through the chair, could you, this is the 5th year of accepting funding for the MRC. Could you give me an idea of what you would consider a capacity for this type of corps in terms of numbers?
Through you, Madam Chair, I believe there are between 200 and 300 members in Monroe County, but this is we actually participate in a statewide system that is populated by the physicians and nurses when they resubmit their request for their licenses. Mm-hmm. And so they can check a box and agree to participate in the local medical reserve corps. So we actually have access to resources all around New York State. But I believe there are 200 or 300 in our county. Most of them are medical professionals. Some of them are volunteers that don't have a professional medical background.
Thank you. That's it.
Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 11-113.
Moved by Legislator Quattro, second by Legislator Daniele. Any discussion? Legislator Andrews?
Sorry, we're on 113, is that correct?
Yes.
Thank you. Legislator Lightfoot just had an emergency he has to leave for, just so you know.
Thank you.
This referral, am I correct in through the chair that the testing here will primarily be done in the town of Irondequoit?
Through you, Madam Chair, actually this funds testing in relation to the tributaries for both Durand-Eastman Beach and Lake Ontario Beach. So I guess it involves both the city of Rochester and the town of Irondequoit.
Okay, thank you. And as a result of this testing, if it's determined that septic tanks are a significant contributing factor, do we have any sort of plan in place to address that? Through the chair.
Through you, Madam Chair, we have a enforcement process, an administrative hearing process in the health department, and if a septic tank is failing, we would implement an enforcement process with them and cause them to make a remediation.
Thanks. Through the chair, can you just explain a little bit more what that enforcement process details?
Through you, Madam Chair, obviously we would first identify that there's a public health problem. Usually that involves raw sewage on the surface or evidence that the septic tank is leaking into a waterway or into a storm sewer. We would first try to get the owner to commit to making a voluntary correction. If we don't see evidence right away that that's taking place, then we would begin the sort of formal process of issuing a notice and inviting the owner in for a hearing. We hold about 50 of these hearings a year in the health department. Usually there's a stipulation that occurs at the beginning of the hearing, and most of the operators of facilities that are clearly out of compliance with the code agree to make changes in their operation, commit to a certain timeline, and generally we reduce the fine that we would impose in order to get them to comply.
Thank you. Through the chair, it sounds like you're doing a lot of this testing currently, but this referral indicates it's the first year the county's received a grant for this. Is it just that this is the first year we've received funding from Health Research Incorporated to do this work? Or is this an actual, in reading the referral, I guess it sounded like it was new, but from what you're saying, it sounds like it's something that we are currently doing already.
Through you, Madam Chair, we've been doing this sampling for many years at both beaches. When Eastman Beach was opened, it obviously required that we do more intensive sampling. We've had this grant, I think, for about 5 years, but there's been a substantial increase in the amount of funding this year. But I don't believe this is the first year of the grant. Oh, it does say this is the first year of the grant. Maybe I'm confused. It may be that we had a similar grant, and it may have been from a slightly different source. But this is a larger amount that we've had, that outside funding that we've had in the past. And so we're hoping to be able to do more extensive sampling in these tributaries that I mentioned before.
Okay, thank you.
Is it possible that this is to purchase equipment through the chair for the sampling, which we haven't necessarily had this equipment before? We've been doing testing, but my understanding was no.
Through you, Madam Chair, this is basically for salaries related to staff that do the sampling and some supplies and mileage. But we're not, the basic cost of the laboratory testing we don't do. Actually, the laboratory tests are sent to the lab at Van Laer, the Van Laer Pure Waters Lab. So we're not making any major equipment purchases.
Thank you.
Legislator Cayley.
Thank you. Through the chair, in a slightly different direction, in I guess in the direction of looking at how we protect the citizens that are presented with a situation where they have to remediate a septic system. I'm familiar with it. I have a little summer place up north, and the rule of thumb up there was don't touch it, because when you do, there's going to be an issue. In Monroe County, do we have standard companies that are regulated or especially deal with septic tank installation with a special permit or not? I truly am not familiar with the process for companies here in New York, in Monroe County.
I'm through you, Madam Chair, I'm at the edge of my knowledge about this, but yes, I do know that there are a number of companies that do most of the residential septic work in Monroe County. There are some smaller contractors, but generally there are a few that we deal with. And yes, the owner of the property does need to get a permit to install a septic tank or to make a major change. And we would like to see the design to make sure that we think it will work before they actually start digging in the ground.
Thank you. And the reason I say this, and again, because I'm familiar with Jefferson County and what it takes to put a septic system in a property that's very close to the waterfront on Lake Ontario. I do know that, and it was sort of kept a secret for a while, that in Jefferson County, a lot of the septic systems are now being installed, but not until the system itself is being designed and written off by a septic engineer, and the engineer actually holds insurance as to not the installation certainly, but they have to write off on the system itself that it's going to do what it says it does in relationship to being close to the waterfront or the amount of perk and so on. And I wondered if that actually exists here in Monroe County.
Through you, Madam Chair, for many of the sort of routine septic installations, it doesn't require design by an engineer. The contractor, him or herself, can submit the plan, but for the more complicated ones, the ones where the property is very small, or where there's a slope involved, or when the property is nearby to the edge of a waterway, yes, then it may be that an engineer would be involved and would have to submit a design. I'm not sure about the insurance requirement, but that certainly would be, I guess, a standard part of a contract with an engineer.
Thank you.
Any other discussion? Legislator Daniele.
This is an expert on this issue, I believe,
No,
right?
no, not at all. Septic tanks, that's my middle name. Through you, Madam Chair, how many times over the past, let's say, 3 or 4 years, have we red tagged or warned residents in that specific area near the lake of a failing septic system? And have we, or I guess, have we found any evidence that several or one or systems are failing in that area?
Through you, Madam Chair, there are several that we've identified in the last few years, but I can't give you the exact number. I'd be happy to provide that before the next meeting.
That's not necessary, but have we, through you, Madam Chair, have we warned them in any way? Have we started the process? Or are we even able to identify a specific residence that has a failing system, or we just know that there are some systems that are failing?
Through you, Madam Chair, no, we have identified several that are failing. I mean, basically, the process is walking the tributaries and taking samples every couple of 100 feet, and at some point the sample becomes, or the sample goes from being positive, showing bacteria, to negative, and so then you know that the failing septic tank or the source is below that point, and you can then begin to figure out where you think the problem might be coming from. Sometimes it's very obvious. There's a smell, or there's softness of the ground, or the grass is growing bright green. Sometimes it actually involves doing sampling and testing the water that is in the area. But I know that we have identified a few in that area.
Thank you.
And Legislator Andrews.
Thank you. Through you, Madam Chair. You know, if this is a problem, that there at least have been some that have been identified, and my understanding is that the county doesn't have any regulations for septic tanks, but possibly other areas do. Is that something that we could maybe look at that might help, is having regulations for septic tanks?
Yes, it is.
Through you, Madam Chair, this is regulated, I believe, in the Monroe County Sanitary Code, in the State Sanitary Code. It's the private wells that are not actually regulated. That's the area that in many counties they have passed local laws or amendments to the sanitary code to assure higher quality of drinking water. But no, there is a legal authority for us to require the submission of plans and the inspection of the work before the pipes are covered.
Okay, thank you.
Any other discussion? And seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 11-114.
Moved by Legislator Daniele, second by Legislator Rocco. Any discussion? Legislator Andrews.
Thank you, Madam Chair. Through you, could I request just the updated, some updated statistics for STDs in the jail and correctional facilities, please?
Through you, Madam Chair, yes, we can do that.
Thank you.
Any other discussion? All those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 11-115.
Moved by Legislator Quattro, second by Legislator Daniele. Legislator Andrews.
Thank you, Madam Chair, and through you, could I just get a description of what this program actually does?
Through you, Madam Chair, I would say about 10 years ago, the New York State Legislature made some special funding available for public health clinics and for disease control programs in the area of sexually transmitted diseases and tuberculosis. And we have been the recipients of those grants for a number of years. We have quite a bit of flexibility in how we spend the money. We're required to submit a work plan as a requirement for getting the grant every year. But as you can see, the funding grand total for this year is approximately $340,000. And basically, the funding is used for clinic services at the STD clinic. We provide services at the main clinic site in Bull's Head Plaza, but we also provide services in the Monroe County Jail, in the correctional facility, and the Children's Detention Center. It's primarily for clinic services and some administrative costs.
Thank you. Then for the past 10 years or so, could you describe whether or not we've had decreasing trends in the rates of STDs in the county, through the chair?
Through you, Madam Chair, to make it very simple, we've seen decreases in the rates of some STDs and increases in others. That has sort of been the trend around New York State, reductions in the rates of gonorrhea. We've seen increases in the rates of chlamydia. The rates of syphilis have bounced around a lot but have been at a very low level. And the rates of HIV have been fairly constant over the last 10 years.
Thank you.
Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 11-116.
Moved by Legislator Rocco, second by Legislator Daniele. Any discussion? Legislator Andrews.
Thank you. And through you, could I request the same data here, just the updated statistics for STDs at the Children's Detention Center, please?
Yes, we can do that.
Thank you.
Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item. Oh, I'm sorry, and that was the last item. Seeing anything else, any under matters, I would think that Dr. Doniger maybe would like to give a little presentation here this evening about HIV in Monroe County, updating us. Thank you, Doctor.
Madam Chair, I was asked to update the committee about the changes in the epidemiology of HIV that we began to notice last year, and brought this to the community in a press conference, I believe, in November. We were seeing, the major change that we were seeing was more cases of HIV being diagnosed in those under age 25, and I felt that that was an alarming change. But if you look at figure 1, you can see, as I mentioned before, the number of new cases of HIV that we've been diagnosing in Monroe County has bounced around a little bit, but it's been in the sort of 80 to 90 range. And in 2009 it was 104, in 2010, and I would say that these are preliminary data, it was only 80. But I would say that basically the numbers have been pretty much flat. We haven't seen an improvement in that area nearly as much as we would like. But the number of new cases for patients under the age of 25 is figure 2. And you can see the number of cases that we diagnosed in each year going back to 2006. And 2010, the number was 36. I think this is the first time that we've presented it this way to you, and I think it's fairly impressive that change has occurred. So for the first quarter of 2011, down at the very bottom of that sheet, we see 24 new cases of HIV have been diagnosed. So in the first quarter, that looks like if we stay on track, we'll maybe hit around 100 again this year. It obviously can vary from quarter to quarter. About a third of them are under age 25. So if we hit 100 and we have a third of them below age 25, we're probably going to be in the 33 to 36 range again for 2011. It's really too early to make definite predictions about 2011, but I think it's probably going to be more than just a blip, that this is probably a trend that is continuing. On the next sheet, I provided a little bit of an update on the coalition that we convened back in June 2010 to work on the issue of HIV in young people. And I've talked about this here a few times. The coalition is really led by an organization called the Monroe Council on Teen Potential, which is primarily a youth-serving organization. They have a lot of activities and programs for youth in our community. Many of them relate to adolescent sexuality, teen pregnancy prevention, STD prevention. You can see the names of some of the other agencies and organizations that have been working together on this. Developed a communications campaign and social marketing campaign with the goals of encouraging youth to get routine medical care, to get STD vaccines, hepatitis B, HPV vaccine. Obviously, there are some STDs for which we wish we had a vaccine, but we don't yet. HIV, gonorrhea, syphilis. To get HIV testing, to get STD testing. And the campaign slogan, "Let's burst the bubble." Almost half the people who got HIV in Rochester in 2010 were ages 13 to 24. And the slogan, "Stop it, pop it, protect yourself," was the title of a song kind of a rap song that has been developed and has been playing on some of the local radio stations. It's also a website that has been developed and a page on Facebook that has been advertised, and a lot of kids have been going to it. There's a billboard and poster campaign. The billboards have been posted on streets in the high-risk neighborhoods. The posters have been placed on the RTS buses that city school district students ride. There have been 5 different posters, and The same graphics have been used for the billboards. There's a music video that I decided not to set up and show for you tonight, but if you go to this web address, you can take a look at it, and it's on YouTube. There have been a number of special events that have been occurring. On Facebook, the third page, you'll see that there is a page for the Rochester Coalition to Stop HIV, and there's been a lot of postings by young people that have been interested in the issue. It seems like kids in the community are interested in this issue. There seems to, I think that we've been successful in building awareness of the fact that HIV is more common in young people in the community, and that the risk is greater for young people than ever before. Obviously, it's going to take some work to try to sustain this and to try to get the goals that I mentioned met. The work so far has been funded by a grant from the State Health Department that came through the University of Rochester, and we're hopeful that we'll get some more grant funding to continue this work this year.
Thank you, Dr. Doniger. Anyone like to ask any questions of Dr. Doniger at this time? Legislator Daniele.
Yeah, through you, Madam Chair, one quick question. Is there any correlation made during this analysis related to drug use or, I guess drug use or drug addiction, and is there a correlation between the two, significant at least?
Through you, Madam Chair, intravenous drug use and the sharing of needles has been shown to be a risk factor for HIV infection since the beginning of the epidemic. That has fallen way down as actually one of the risk factors. Somehow in the intravenous drug using community, transmission of HIV is no longer occurring. So that is not an issue. I think that drugs and unsafe sex probably go together. Alcohol, cocaine, marijuana, those are certainly risk factors and are probably fueling the transmission of HIV infection in the community. These are risk behaviors that frequently go together.
Any other questions? Legislator Andrews.
Thank you. Thank you for the update, Dr. Doniger. You mentioned that we're hopeful to receive another grant from the University of Rochester to continue to sustain this effort. Is this something that the county contributes to financially as well?
Through you, Madam Chair, the specific grant that I mentioned was from the New York State Department of Health, and it was convenient to tag it on to a funding stream that already went to the University of Rochester. So it's actually state funds. The county makes a very substantial contribution overall in the area of STD control. I can't tell you the exact dollar amount, but it's probably in the range of $1.5 or $2 million. And you combine the budgets for the activities at the STD clinic, the laboratory testing, and then the work that staff do to interview the cases and do the contact tracing and the counseling that are those that are positive. Obviously, we've adjusted the work according to the changes in the epidemic, and there's a lot more activity going on related to young people in the community.
Thank you. The county itself doesn't make a direct contribution, though, to the Monroe County or the Monroe Council on Teen Potential, correct?
Through you, Madam Chair, you're correct. There isn't a direct outlay of county dollars, but our staff are very, very involved in working on this. It's hard to put a dollar amount on it, but for printing posters and for paying for billboards and for paying some of the artists that have been involved in doing some of the artwork, we've been using grant dollars for that.
Thank you. Are there any upcoming events or special programs that are planned that you could make us aware of, either this coalition is putting on or that the county itself will be doing in the upcoming months?
There is a National HIV Testing Day coming up in June, and there will be some activities going on in the community, and I presume that they'll be publicized through the Monroe Council on Teen Potential and through this network of organizations that are working on this.
Okay, thank you. And then at the end of the year, if we see that this trend is a trend and it's not a blip, but there still is about a third of the folks who are identified are young people, will you reevaluate our plan at that point in time and see if we need to change what we're doing to more focus in on addressing young people, or what do you think we'll do at that point?
Through you, Madam Chair, I think that that the HIV epidemic has been one where things have changed from year to year quite a bit, and it does require reevaluation constantly. And we will certainly continue to do that and see if there are new things that come along that have been shown to be effective in other communities to try to address this problem with young people. I think most of our experience has actually been with the older population, with those over the age of 25, and so it's taking a little time to change gears a little bit.
Okay, thank you very much, and thanks for giving the report today. Appreciate it.
Yes, thank you. Any other matters to come before this committee? Legislator Anders.
Madam Chair, I just have one question. We talked a little bit about it at the last committee meeting regarding the possible outsourcing of the food service and laundry workers at the Monroe Community Hospital. I wondered if an administration official could provide an update in terms of the status of where that is as of today.
Through the chair, there is no change in the status. We're still in the process of discussing it and deliberating.
Thank you. Do you still anticipate a referral coming to us by June or July to authorize that?
Through the chair, I couldn't commit to that at this point.
Thank you. Can you let me know approximately when do you think you'd be able to let me know when to expect that?
Chair, I'm sure we can give you an update next month. You can ask again and see if we're any closer to making a decision.
Okay. Thank you.
Thank you. There being no other business, the April 26th meeting of the Human Services Committee stands adjourned. The next meeting of the Human Services Committee is scheduled for May 24th at 6 p.m. here. Thank you. Have a nice evening.